Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wisi.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. Reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Ebers, DHS Secretary-designee Andrea Palm, and frontline worker Kteile Smith, a nurse who works for St. Paul Elder Services Incorporated in Kaukauna. Also available to answer questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We'll begin the briefing with remarks from Governor Tony Ebers.
Thank you. Good afternoon, everyone, and thanks for joining us today. This week, we reached an unfortunate milestone. Every county in Wisconsin has now reported at least one case of COVID-19. This disease is impacting every corner of the state, and we now have fewer tools at our disposal to help mitigate the spread. That means it is more important than ever that Wisconsinites answer the call to stay safer at home as much as you can. Wear a mask in public and practice good hygiene and social distancing. If you're a business owner, it means following the best safety practices to keep your workers and your customers and communities healthy and safe. Wisconsin Economic Development Corporation has released comprehensive guidelines to help businesses make these good decisions, and I urge everyone to take a look at these resources. The COVID-19 pandemic has hit Wisconsinites hard, physically, emotionally, and financially, and we all must do our part to get through this crisis and get back to our Wisconsin way of life. With the passage of the CARES Act, the federal government authorized over $2 trillion in relief to address the public health and economic impact of COVID-19. Wisconsin's share of the CARES Act is $2 billion. This relief is sorely needed. Prior to COVID-19, Wisconsin's economy was strong. In fact, we are seeing a steady decline of the unemployment rate this year to near record lows. COVID-19 has changed that. Wisconsin's unemployment rate in April was 14.1%. The Department of Workforce Development is taking significant steps to meet the needs of Wisconsinites. They have expanded their hours, and they're adding up to 1,300 staff, including contractors, state employee transfers, and new hires. I know that for folks who are waiting and struggling, this is an incredibly and frustrating, difficult time. Our staff is working around the clock to help get these benefits paid out as soon as they possibly can. Everyone who is eligible for benefits will receive the benefits they have earned. We'll get our economy working again, but we need to be smart, safe, and follow the lead of science. The $2 billion in CARES Act funding Wisconsin has received will help jumpstart our recovery. This week, we made some major announcements on how we're putting those dollars to good use. As we make funding decisions, we are ensuring these dollars go where they are most needed. Earlier this week, we announced a $1 billion investment in testing, contact tracing, and support for local governments that is needed to stop the spread and box in this virus. We're also using these funds to bolster our supplies of personal protective equipment for our healthcare workers, first responders, and local governments so that they can do their jobs safely, and we're investing in ventilators and other patient care efforts. To jumpstart our economy, we announced a $75 million small business grant program that will provide assistance to Wisconsin's Main Street businesses with the expectation they uphold and follow health and safety recommendations to protect workers, consumers, and their communities. This will help, but we know that many Wisconsinites are struggling to make ends meet and keep a roof over their heads. That's why we're also investing $25 million in Wisconsin Rental Assistance Program to provide up to $3,000 of assistance to eligible renters to prevent evictions and to ensure housing stability. We also announced a $50 million investment in direct payments to Wisconsin farmers, as well as a $15 million investment in combating food insecurity across our state. This plan is a win-win as we're connecting the high-quality food that our farmers produce with the people who need it most. And today, I'm excited to announce a $100 million grant program to support long-term care facilities, home and community-based services, and emergency medical services. We recognize the significant burden that the COVID-19 response has placed on these providers. We also recognize the integral role they play ensuring the health and safety of some of our most vulnerable Wisconsinites, and we want to support their efforts during this pandemic. The program will be administered in two parts, an initial phase of funds to support immediate needs, and a second targeted release for additional needs of individual providers. Both rounds of funding will be allocated to support expenses directly related to COVID-19, as well as expenses associated with the interruption of typical operations such as overtime pay, changes to sanitarian procedures, and disruption to the standard delivery of care. Emergency medical service providers have been on the front lines in their communities responding to COVID-19. Long-term care facilities and home and community-based service providers are ensuring the elderly and people with disabilities can stay healthy and safe in their own homes and communities. These providers are experiencing significant challenges as pandemic-related expenses like purchasing necessary PPE and retaining workers have increased operating costs. This funding will make it possible for this network to continue providing their essential services, protecting many of those most at risk from the virus. Now, these are all important programs that will help move the needle, but this funding is just an initial investment in what's needed to get us back on track. We need the federal government to come back to the table to provide continued relief for state and local governments that have been shouldering the economic burden of the response to this pandemic. This pandemic has also shined a light on existing inequities in our state and nation. So as we move toward recovery, we must use every tool we have to ensure we're creating a more equitable and sustainable state for all Wisconsinites. Wisconsin must be a state where nobody gets left behind and where everybody is valued, especially in this scary and uncertain time. It's completely understandable to be afraid. Fear is a normal reaction to a pandemic, but hate is not. In recent weeks, we have seen a spike in hateful actions and language against Asian Americans on a national and state level. Our Asian American community deserves our support, just as any community in our state deserves our support. No one is at fault for this virus. This virus does not discriminate, and it does not give an excuse for people to either. These actions hurt your neighbors and friends and family, even if you don't realize it, because we are all in this together, and if any one of us is unsafe, that affects our entire state. In the middle of this pandemic, we are already worried about our health and safety. So much is uncertain, but one of the things we should be able to rely on is Wisconsin's support for one another. COVID-19 is a crisis for our state and our country, and a crisis can cause people to come together or can cause them to break apart. I know that we are better together, Wisconsin. We are better than fear and hate and anger. Wisconsin, I'm asking you to come together to bond in our common goal of safety and health and recovery, and to reject hateful actions. It is the best and only way forward. When Wisconsinites come together, we can make great things happen. Let's all do our part to box in this virus, keep our communities safe, care for one another, and get back to our Wisconsin way of life. And now, before Secretary-designee Andrea gives her daily update, I'd like to let you hear from one of those healthcare workers on the front lines, Kteile Smith, ADN, employee at St. Paul Elder Services, Inc. Take it away, Kteile.
Thank you, Governor. Good afternoon. My name is Kteile Smith, and I'm proud to work for a long-term care facility that was as prepared as any for a pandemic like the coronavirus. Our staff know why each protocol is necessary, how we execute each one properly and effectively, and how they contribute to our overall goal of protecting ourselves as healthcare workers, our residents and patients, and our organization as a whole. We are participating in the all staff and resident testing that the state is providing for us, and we need that type of support and coverage of testing on an ongoing basis. We have had 2 positive cases between our campuses, and we have successfully done our job in ensuring that those individuals did not spread their infections to others. Long-term care facilities have a whole lot of infection control competence and skill, but we also have a commitment to doing what is best for those we serve. As a caregiver, I have the privilege of having conversations and hearing our residents' feelings as I serve them during this difficult time. Their voices are full of gratitude, but I also hear the worry and the fear, the possible reality that they will not see their family again until they are dying. They are counting on us all to do our part to allow them to see their loved ones again, sooner rather than later. As much as our residents miss having their friends and family come and go freely, miss embracing their children and holding their grandchildren, they know that the safest thing for them is to remain sheltered here from the illness transmission that may be occurring amongst the public in our communities. They absolutely understand the regional and statewide approach to resuming normalcy may have disproportionate impacts on them. They want to know that the communities they live in and contribute to are coming together in ways that will protect them. They know that the greatest risk for an outbreak is that we as staff may pick up this virus in our communities and unknowingly bring it through our doors, or that as we reopen, a visitor may do the same. They want to know that people care enough about their lives that everyone is taking all of the recommended precautions to mitigate the risk that this virus comes through our doors, which we know includes masking in public, ongoing physical distancing, and staying home when sick. They also want to know that the government is providing the funding and resources needed to us as their healthcare providers to be able to do regular testing, to acquire all needed PPE, and to retain the staff needed to implement best practice infection control systems. The phrase, "it takes a village," could never be truer. Our residents have been made to feel at times that their lives are expendable, and I can speak for every caregiver in this state when I say with my whole heart that they are not. These are your moms and dads, grandmas and grandpas, friends, sisters, brothers. They have stories and legacies and life to live yet. As a frontline caregiver, I'm making ongoing sacrifices that others are not. I'm not going to dinner with my friends. I'm not allowing my children to have play dates. I'm not going to the salon for services that I typically would. I'm wearing a mask when I go to the grocery store to avoiding situations that present the risk for exposure. Again, I know I speak for my peers when I say that I do not want to be the person who unintentionally brings this awful virus through our doors. Our residents need us, and they need us to be healthy. But as long-term care staff, we are a small part of the broader community, and we should not shoulder all of the responsibility for keeping this virus out of our facilities. This is a public health crisis that requires so much more than our individual sacrifices. We will continue to fight for every resource we need to protect the lives of those we serve, because we will not let loss of life in our facilities become an expected or acceptable outcome. Each person impacted by this virus has a name. They have a family and a story behind it, and we won't compromise and risk losing even one. Thank you so much for the opportunity to speak on behalf of Wisconsin's long-term care workforce and the residents and patients we so desperately seek to protect during this crisis. I will now send it back to Secretary-designee Andrea Palm.
Thank you, Kteile, for sharing your story and for the incredible work you and all of your colleagues are doing with some of our most vulnerable neighbors, friends, and family members. The Wisconsinites working in our long-term care facilities are on the front lines of the COVID-19 pandemic, and we want to support them as much as possible. I've seen the stories of young people writing letters to grandparents and families hanging hearts in their windows, and it's very moving to see so many of you taking action to show your support. Actions like these help our frontline workers like Kteile build resilience as a community. Building resilience, the ability to bounce back from adversity, is key for our healthcare providers, and it is also integral to our own health as individuals. During this pandemic, it makes sense to pay attention to our physical health. And if you have symptoms of COVID-19, please get tested. But we also need to pay attention to our mental and emotional health and ask for help when we need it. This is why Governor Ebers issued a proclamation declaring May Resilient Wisconsin Month, and it is why we are expanding our Resilient Wisconsin initiative at DHS. Resilient Wisconsin is designed to provide tools and resources for reducing stress and dealing with the emotional challenges of this pandemic. We have added content specific to Wisconsinites who may be experiencing especially high levels of stress due to COVID-19. Frontline workers and their families, people facing elevated health risks, and disrupted workers and their families. If you're looking for support or want to explore these resources because you're worried about a friend or family member, please visit resilient.wisconsin.gov. Our mission at DHS is to protect and promote your health and well-being. That includes both your physical and your emotional health. They're interconnected and both deserve attention and care. And remember, it is okay to ask for help. So I'll end today with an update on the numbers and a couple of reminders. Here's where we stand. We have 53 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 14,140 tests. We have 163,238 negative tests, which is an increase of 8,938. And we now have 13,885 positive cases of COVID-19 in Wisconsin, an increase of 472 people. Our total deaths have now reached 487. So for the reminders, if you're experiencing any symptoms of COVID-19, please get a test. The first step is to call your healthcare provider. The DHS website also lists the locations of community-based testing sites, and I'd encourage you to check back frequently as we add testing sites on an ongoing basis. Remember, if you test positive, you'll receive a call from a contact tracer. Contact tracing is critical to our boxing in the virus, and your willingness to pick up the phone and help with this piece of our state's response to COVID-19 is essential to our success. Thank you, Wisconsin, for all the work you're doing and will continue to do.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question, and in the interest of time, only one question per reporter. And we'll begin this afternoon with Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for taking the question and the call today. Regarding the rental assistance program that was just announced, I know the temporary ban on evictions is expiring already on May 26th. So how quickly will the information be available for individuals to learn how they can go about applying, when they can see this money, and you know, get access to this program? Yeah,
that's a real important question, and we are now in the process of finalizing that procedure to make that happen. The money's already here from Washington, D.C., so we're going to get it out as soon as possible. So hopefully by the end of this month, early next month, we believe that money will be accessible by the folks that need it. Certainly when the Supreme Court made their decision and various orders expired, this made eviction more of a possibility, and that's why we're doing what we're doing with these resources.
Thank you, Jonathan. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Yes, thank you for taking this call. My question is for Dr. Palm. We have all of the confirmed cases here in our area in Forest County designated to a specific nursing home, specifically the Bay at New Rock. I understand the Forest County Health Department is already investigating, but I wanted to know if they were reaching out to DHS for further aid, or if you guys have heard anything in regards to the outbreak there.
I will admit, Mason, that considering the number of outbreaks and investigations that are going on across the state, I'm not personally specifically aware of this particular facility in Forest County, but we certainly would be happy to get back to you with details.
Thank you, Mason. Now to Ben Krumholtz from WLUK-TV in Green Bay. Ben? WLUK-TV in Green Bay.
Hi, thank you for taking our questions. When do you expect the state to release guidelines for schools on reopening, and how much do you expect those guidelines will mirror what we're seeing from the CDC?
I'm not sure about that, how to answer that last question, because we are focusing on what matters here in Wisconsin. We have met with Carolyn Stanford Taylor, Department of Public Instruction, and others. We hope to have some options available for people by the middle of June, I would say, maybe a little later. But my interaction around this issue is this. I think our goal should be to have school open this fall, but but we also have to be prepared for alternatives A, B, C, and D. This virus certainly is unpredictable, and so we want to make sure that we do the right thing. But I think as a grandparent and former teacher, some normalcy for our kids is necessary. So it should be our goal. Whether it looks different than it certainly will look different than it did before the pandemic happened. But we want to make sure that our kids have the opportunity to have some normalcy in their life.
Thank you, Ben. Now to Todd Richmond from the Associated Press. Todd? And a reminder, *6 to unmute your phone. Todd Richmond from the Associated Press. Okay, we'll move on then to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick? Patrick Marley? Okay, let's try Tim Stum from Wisconsin Health News. Tim?
This is Patrick. I wanted to ask about this new program of $100 million for nursing homes and other facilities. How will you determine who gets that money and how much will they be eligible for?
I believe we have used Medicaid, the amount of money they receive from Medicaid as a barometer for how it would be determined, how it would be distributed just globally. And then from that, based on expenditures that have occurred.
Okay, thank you, Patrick. Now to Tim Stum from Wisconsin Health News. Tim? And a reminder, *6 to unmute your phones. Tim Stum from Wisconsin Health News.
Hi, thanks for taking the call today. Wanted to follow up on that last question. You announced some additional federal money that is heading towards long-term care facilities today. How do you respond to a concern from many of these long-term care providers that while some financial assistance is heading their way to support losses they've faced due to responding to COVID-19, that so far no state funding or state financial assistance has directly headed their way? Is there a plan for any state assistance to head to these providers?
Well, certainly, I know we had some legislation prepared. I'm trying to think back to the original request of the legislature that went nowhere. So I don't exactly remember that, but certainly we will look at it. But we want to use as many resources as possible from the federal government. In addition to this $100 million that is going exclusively to these two primary areas, long-term care and also emergency medical services, the state is participating in lots of things around long-term care, such as PPE, such as testing materials, such as the ability to provide resources around testing and contact tracing. So it would be probably incorrect to say that the state hasn't done anything for them, and there may be other arenas that we have spent time and money working. We certainly value the nursing homes, long-term care in the state. Frankly, the previous care money that was allocated to hospitals did not allow us to provide money for nursing homes, and that's why we are having this special set aside for them now.
Thank you, Tim. Now to Riley Vetterkind from the Wisconsin State Journal. Riley?
Hi, thanks for taking my call. Governor Ebers, a federal lawsuit was filed yesterday against counties and cities with stay-at-home orders in place. It looks like you and the Elections Commission are also listed as defendants. What would the near and long-term consequences be if those local orders are struck down? And does the state plan to have a large role in the defense against this lawsuit? Thanks.
Sure. This is Ryan Nilsestuen, and I'd be happy to answer that. We'll be defending against that lawsuit. We believe that it should be dismissed, and we'll be fully defending against it. In terms of these local orders, I think one of the consequences of the Supreme Court's decision from the other week is that they created a massive amount of confusion across the state, and it created this 72-county approach to dealing with the pandemic. And even within counties, you're seeing different municipalities having different rules. In terms of the validity of the orders, though, the Attorney General issued a very timely opinion on this, saying that the orders are valid and provided guidance on how to enact those. So I think, this is unfortunately because of the Supreme Court's decision and the failure of the legislature to act. The local public health officers have been on the front lines in dealing with fighting the disease, and now unfortunately, they're being put at the front lines of the litigation involving these. But I am optimistic that this lawsuit will go nowhere.
Thank you, Riley. Now to Brianna Riley from the Cap Times. Brianna.
Hi, thank you so much for having me. So some states are facing scrutiny for combining results from diagnostic and antibody tests and publicizing that information in a way that's a little misleading. I'm curious if Wisconsin is collecting the results from these antibody tests that are being conducted and what the plan is for sharing them publicly.
I can talk about this. Ryan Westergaard from the Division of Public Health. So we are collecting information about antibody tests for surveillance purposes, but are not including those tests as part of our daily confirmed cases. And the reason for that, we've talked about on this call before, is that they're not potentially useful for diagnosing acute illness, and there's less in terms of quality control to be certain about them. So if there is a positive test that a healthcare provider or someone in another setting orders, we do request that that's reported to public health. We consider those to be probable cases, but we don't report them with our confirmed cases. The real value for antibody tests, we feel, is going to be on sort of in the aggregate in terms of a research or surveillance purpose to see how many people have been infected over time. But it's not the testing that we use for diagnostic purposes and not the ones that we put in our daily counts.
Thank you, Brianna. Now to Marty Glaser from Spectrum News 1. Marty? Reminder, *6 to unmute your phone. Marty Glaser from Spectrum News. Okay, we'll move on to Rachel from TMJ4. Rachel?
Hello there. We're hearing some chatter on social media and such that Milwaukee area hospitals are seeing a spike in patients. Just wondering, we also know that, we have increased testing. So just wondering if you can talk a little bit about the spike in patients and testing and just kind of the impact overall.
Yeah, so I think on the testing piece, it's important to recognize that while we had an increased number of positive cases today, we also had our highest number of tests that we've ever done in a day, 9,400 of them. And so the positive rate was only 5%, which is a good percentage. That's where we want to be over the trend here. So while we're seeing increasing numbers of positive cases, what we want to make sure and what we're looking at in our metrics is the percent positive, and we want that to go as low as it can. And so we feel pretty good about the 5% number today. As it relates to hospitalizations, we certainly are tracking that closely, and you can see that on the website regionally. Hospital bed capacity, as well as ICU bed utilization and ventilator usage, and so we're tracking those kinds of metrics all across the state to make sure that we have that we know when our hospitals are seeing an uptick in cases, an uptick in hospitalizations, and we certainly, it is why we have built and worked on the surge capacity, not only at the regional level with hospital systems across the state, but also through our alternate care facility in Milwaukee, and the one that we have started here in Dane that we would be able to stand up quickly if we needed to. And so those assets are going to be important moving forward as we continue to track the spread of this and potential surges through the coming months.
Thank you, Rachel. Now to Steve Presta from the Platteville Journal. Steve.
Thanks for taking my call. I've noticed in the last few weeks or so, probably starting before Easter, that the county health departments have been issuing statements that sound very similar, like word for word, from each other. And so I'm wondering, how much is DHS telling county health departments to say about how to communicate with county residents on all of these issues? Things like the whole church thing before that clarification, and how to deal with the situation after the Supreme Court decision.
So I think what you're certainly hitting on is the partnership and the fact that we, as state public health and county local public health, are of the same system, right? We're all fighting the same virus. We're all working together to do what we need to do to box it in, and we certainly are sharing best practices. We're certainly sharing information about what's working, what's not working, the lessons we're learning, how to be most effective in this response. And so coordination in those efforts is certainly key. A lot of the phrasing, right, is classic public health phrasing, contact tracing, et cetera. So I'm not sure specifically which phrases you're talking about, but we certainly are in very close coordination with our partners in public health all around this state, because it is the way we will be most effective.
Thank you, Steve. Now to Stephanie Hoff from WisPolitics. Stephanie.
Good afternoon, and thank you so much for having this call. My question is for Governor Ebers. In regards to unemployment, you've contracted with call centers to handle the crush of calls, but they won't be online until next month. So my question for you is, did your administration wait too long for these resources to go to the unemployment program? And what are they doing now to address the thousands of claims that remain unpaid?
Well, we've contracted and added 4 additional call centers, a 500-person call center for UI benefits, a 40-person call center for PUA benefits. And additionally, we expanded the hours. And I just have to clarify this, because some people ask the question, so why don't you go 24 hours a day? The system works this way. You collect information, the application materials from the client, and then that same system provides the money to people. So if we did nothing but take application, we would not be able to pay anybody. So that needs some clarification. But we last week we onboarded 100 additional staff, and this week we're adding 300 more people on May 12th of this, or May 18th of this year. We had 2.1 million claims received, and 1.4 million claims have been paid. And this doesn't mean that many people have multiple claims, so you can't use that barometer to say that 700,000 people didn't receive their money. But the fact of the matter is, we are having great. The vast majority of people are receiving their checks. We are adding people, as you can see, over a period of time, and we'll continue to add people as we can going forward. It's not a foolproof system, as we all know, but we are adding people, and we're doing the best we can. We're having some success. We're having great success.
Thank you, Stephanie. Now to Jason Kelby from WITI TV in Milwaukee. Jason?
Thank you for taking my call. I want to get your reaction to the possibility that the National Guard deployment would end on day 89, and have you heard anything on the status of the federal activation extension?
I haven't.
I can answer that question. So, one of the challenges, and it's been widely reported, is that the extension of, or the amount of time in which the Wisconsin National Guard and other guards around the country can be on federal status ends one day before they would receive retirement and educational benefits. The administration sent a letter earlier this week, or maybe at the end of last week, requesting that President Trump extend the amount of time in which the National Guard can be on federal status. And this is important not just for Wisconsin, but for states around the country in terms of the very critical role that the Wisconsin National Guard is playing in fighting this pandemic. Here in the state, is being used to operate 25 testing teams around the state. In addition to that, they've been providing critical support for the state's response, from working at the State Emergency Operations Center to providing staffing there and expertise. And in terms of long-term care facilities, for example, being able to provide emergency staffing when there's been significant staffing shortages as a result of COVID-19. So it's very important that the federal government continues to support the Wisconsin National Guard and guards and other states' guards because of the critical role that they're playing in fighting this disease.
Thank you, Jason. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking the call. My question is actually for Kteile Smith here. What does this money mean for small facilities like that? What does it go towards? And then what do these investigations into cases look like from the facility side rather than the state side? Thanks.
I believe Kteile is unavailable, Casey, but if you want to touch base with us later, we'll try to contact her for you. And we'll move on then to Jessica Van Egren from Up North News. Jessica?
Yes, thanks for taking my call. Mine is a follow-up question to something that was asked earlier as far as state funding being allocated to long-term care facilities. I just wanted to double-check that there was no state money allocated for these facilities in the legislation that was passed back in April. And what would be involved if the state were to decide to allocate funds to such facilities in the near future? Thanks.
Thanks, Jessica. This is Brian Nilsestuen. The legislature didn't allocate any money for long-term care facilities or providers. The bill that was passed, Act 185, provided a very limited response to the COVID-19 pandemic, and it didn't include any federal funding at the time. I believe state legislators said that they wanted us to first see what would be available from the federal funding. So what you're seeing in terms of today's announcement of the $100 million, that's from the CARES Act funding passed by Congress. And if there is any state funding, it'll have to come from the legislature getting to work and passing a bill allocating funding to long-term care providers.
Thank you, Jessica. Now to Jeremy Janine from Urban Milwaukee. Jeremy.
We are seeing a surge in new hospitalizations. Does contact tracing show where those are coming from? Are they long-standing cases getting worse, or are they new cases after Safer at Home was struck down?
So I think, Jeremy, your question was if the hospitalizations we're seeing now are as a result of the lifting of Safer at Home?
Correct.
So I think, hospitalizations lag infection, for obviously longer than the testing does, because it's not till you've been infected for a while that you're, generally speaking, that your symptoms get bad enough to require hospitalization. So I think we generally think, and I'll look at Dr. Westergaard here, we generally think that the lag on hospitalizations is about 3 to 5 weeks post-infection. And so I think it's certainly safe to say that any uptick we're seeing in hospitalizations right now is not a result of the end of Safer at Home.
Yeah, I guess I'd clarify. There's a pretty wide range of when illness. It's been well described for this virus that for reasons people don't really understand, that after a week or two of feeling relatively well, people can certainly take a turn for the worse. But it's certainly not uncommon that people can get severe symptoms in the first several days of diagnosis. So, but aside from that clarification, I think the answer I agree with is it's too early to know. It's too early to say that the numbers we saw today and yesterday are part of a trend. And it's we see associations of two things can't conclude that one caused the other without really a lot more information. So I agree with that.
Thank you, Jeremy. Now to Ben Meir from WXPR Radio in Rhinelander. Ben?
Good afternoon. This question is for Secretary Palm. Secretary, for you and for a big chunk of your department, understandably, a big chunk of your attention and efforts have been focused on the COVID-19 pandemic. I'm curious, within DHS, what policy priorities or what items or projects have had to be delayed or put on hold because attention is being paid toward the COVID-19 pandemic?
It's a great question. I think one thing to remember about the Department of Health Services is that about 2/3 of the folks who work at DHS work at our 7 24/7 facilities that serve Wisconsinites around the state. And so as essential workers and workers providing care to people who live in these facilities, that work is the same now as it was before the pandemic. Obviously, there's increased attention to infection control. There's increased attention to the things we all need to be doing to make sure we're not spreading the virus. But certainly, all of those employees who were doing that essential work before the pandemic continue to do it now. I think the other thing I would say is those most impacted by this virus economically also many of them interface with our department through the other programs that we have, whether it's the food share program, whether it's medical assistance and badger care, whether it's programs that serve folks in long-term care, people with disabilities, those home and community-based services. Those are all programs that we provide support and assistance to the providers who are serving Wisconsinites all across the state. And so that work has also continued because it is essential work, certainly, to support families who need badger care, to support families who need food share, and those in our long-term, across the continuum of our long-term care. So all of those programs have certainly continued to operate in the same way, but with certainly increased activity as we've seen economic consequences for those across this state. I think some of the programs, some of the nice to haves as opposed to the must haves. Certainly, we have needed to redeploy some of our staff to things like contact tracing and other parts of the response, and have done that. In as much as we can, while continuing to absolutely continue to provide the essential services in our facilities and through the programs that we operate across DHS.
Thank you, Ben. Now to Danny Maxwell from WKOW in Madison. Danny? Danny Maxwell from WKOW. A reminder, *6 to unmute your phone. Okay, we'll move on then to Melanie Conklin from Wisconsin Examiner. Melanie.
Hi there. I hope you'll permit me a quick moment to give a shout out to Jenny and the team of sign language interpreters you have there, Governor. I had the pleasure of interviewing them, and you have a great team. My question is, if you have any response, if you saw the former Governor Walker's New York Times op-ed saying that instead of, quote, propping up failed state bureaucracies, the federal government should support American workers, and in particularly any response in light of the CARES funding that you've been announcing this week.
Yeah, I didn't have the pleasure of reading that. I'll have to check it out. The CARES funding has been helpful, but I will say the state of Wisconsin and other states, and we talk regularly with the Midwest states, obviously need more resources. We are certainly, we're struggling as a state financially, and we also struggle in making sure that our long-term care facilities, our hospitals, and others have the ability to survive given the pandemic. So I think the federal government needs to continue to consider stepping up and it's also critically important that the workers that work in these industries that have had significant outbreaks of COVID-19, they deserve protection too. And I know that it's important that our food chain not get disrupted, but I can't believe in this day and age that we are in a position where you can't do both. It seems to me we should be able to chew and walk gum at the same time. Our workers need protection. They need the services they should get when they're ill, and they need the equipment they need to stay safe and well.
Thank you, Melanie. Now to Emily Davies from WSAW-TV in Wausau. Emily.
Good afternoon. My question is in regards to the emergency nurse aid training programs. My understanding is that an emergency rule is in the process of being promulgated. If it was a part of the previous administrative rule that was ultimately rejected by the legislature, is that a separate rule? Do you plan on doing that separately just to have that program go through? And how will that rule be able to impact Wisconsin's response to any additional surges that could happen later?
Sure, this is Brian Nilsestuen. So the emergency, there's a couple of scope statements that have been submitted. Scope statements get submitted by state agencies all the time, and simply what they are is they provide notice to the public at large that an agency is considering doing rulemaking and promulgating a rule. So the scope statement that was withdrawn on Monday, that would have dealt with implementing different mitigation measures in order to slow the spread of COVID-19. It didn't specify what those measures would be because that's the point of the rulemaking process, is to be able to have those discussions. In terms of the question you asked with licensing, is there was an emergency order that was issued back at the beginning of May to provide significant flexibilities in order to get more nurses and other critical professions where there's critical shortages in order to be able to bring more people back. And this is one of the ways, because the legislature didn't extend the public health emergency, that flexibility went away. And so this is an attempt to do so through the rulemaking process. And we've been looking at with a number of agencies in terms of what can we do through the administrative rulemaking process to provide flexibilities and get more doctors, nurses, and others back into the profession to help deal with the pandemic.
Thank you, Emily. Now to Marty Michelson from Milwaukee Public Radio. Marty. Marty Michelson from Milwaukee Public Radio. Okay, we'll move on then to Adam Rogan from the Journal-Times in Racine. Adam?
Hi, this question I believe would be for Dr. Westergaard. You said a couple days ago, it might have been last week, that there hadn't been any cases of the I'm going to try to get this right, multi-system inflammatory syndrome in children yet in Wisconsin. Is that still true? They were at zero? If yes, where, how many have been confirmed and where? And also, if those cases are found, how are they reported or identified and kind of, brought to the higher levels of the state or the nation?
Yeah, thanks for that question. I'll have to verify to make sure. I have not heard anything today or yesterday. Our announcement and our communication of the new CDC case definition to providers went out 2 days ago. I've not been aware that we've received any reports, but if it has, I'd be happy to get. If we haven't, I'm not aware. I'd be happy to get back to you on that.
Thank you, Adam. Now to WISC TV in Madison. WISC. WISC? Okay, we'll move on then to WISN in Milwaukee. WISN.
Yes, hello. First off, are you aware of a outbreak at the Amazon campus in Kenosha, and that Kenosha health officials are having trouble dealing with Amazon? And if so, is the state going to get involved?
We're gonna have to get back to you on that. I'm not aware of that particular outbreak, but again, we are tracking 230 plus investigations and outbreaks. So,
Sure.
but we'd be happy to get back to you for sure.
And I'd say, in general, we're involved in all such public health investigations. Is that these individual cases and clusters of cases in workplaces or long-term care facilities are required reported to us. So in the Bureau of Communicable Diseases, we're aware of cases as they come in. If they are clustered in a workplace, we recognize that as an outbreak. We post it as a public health investigation, and we make our team available for support. So without knowing the specifics of the outbreak you're referring to, the answer is that in every such investigation that we're aware of, we are available, and our role is to help the local health departments.
Thank you. We'll now go to WBAWHY in Green Bay. WBAWHY. WBAWHY TV. We had a couple of people we called on who did not respond. We'll try again with Todd Richmond from the Associated Press. Todd? And we'll move on then to Marty Glaser from Spectrum News. Marty? WISC TV in Madison. And then our final question today belongs to NBC 15 in Madison. NBC 15.
Hey, can you hear me okay?
Yep.
Okay. My question is regarding, we had received a tip that there was expired COVID-19 tests sent to a nursing home. Can you address expired tests and what will be done to rectify if new tests will be sent to those facilities?
Thanks for the question. I think it's important to be very clear that the date on those tests is the date they were manufactured. These tests are not expired. They are brand new. And so everything we have sent to long-term care, everything we are purchasing through our contracts with Exact Sciences are newly manufactured, and there are no expired tests leaving state warehouses for distribution to any party in the state of Wisconsin.
Thank you, NBC 15. And that will wrap up today's briefing. Please continue to monitor the DHS COVID-19 web pages for information, data, and guidance. More information can be found on the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, Wisconsin Economic Development Corporation, and the Department of Children and Families. Thank you and have a good afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WISI to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.